Okay, we'll begin again then with the laboratory test. So, an alpha fetoprotein or AFP test is a test for the substances produced by tumor cells in the body, and it's found in elevated levels in patients with ovarian cancer. Estrogen receptors are blood tests for a type of protein present on some breast cancer cells to which estrogen attaches. HCG test is a human chorionic gonadotropin test, and that's the blood test for the substance that, if it's elevated, may indicate cancer in the testes, ovary, liver, stomach, pancreas, or lung. A PAP test or Papinicolau test is the microscopic examination of cells collected from the vagina and the cervix to detect abnormal changes, and I think we talked about that in the previous chapter. PSA is a prostate-specific antigen test for some substances produced only by the prostate, and its elevated levels may indicate prostate cancer in its early stages. A tumor marker test is various blood tests for specific substances produced by certain types of tumors. Some general diagnostic procedures associated with this system are a biopsy, and that's the process of removing tissue from living patients for diagnostic examination. An FNA or a fine needle aspiration, and that's the procedure of withdrawing cells from a lesion for examination with a fine needle on a syringe. A radionuclide scan, that's an image scan in which a small amount of radioactive substance is injected into the vein. A machine that measures the levels of radioactivity in certain organs, which may indicate abnormal areas or tumors. Sentinel lymph node biopsy is the removal and examination of the sentinel nodes, which are the first lymph nodes to which cancer cells are likely to spread from a primary tumor. A SPECT scan is the single photon emission computed tomography scan, and that's a nuclear imaging test that shows how blood flows to tissues and organs and can help identify certain types of tumors. Punch biopsy, that's removal of a small oval core of skin for a laboratory analysis, and it uses a sharp hollow instrument. Shave biopsy is the removal of a sample of skin for a laboratory analysis using a scalpel to slice the specimen from the site. Cholecystography or hepatobiliary immunodiactic acid, HIDA scan, is the imaging test used to examine the function of the liver, gallbladder, and bile ducts. ERCP is an endoscopic retrograde cholangiopancreatography, and we always call it ERCP, is a procedure using X-ray and injectable dye to examine disorders in the bile ducts, the gallbladder, and the pancreas. An EUS, an endoscopic ultrasound, is a procedure using an ultrasound imaging device on the tip of an endoscope for evaluation of the bowel wall and the adjacent structures. An MRCP is the magnetic resonance cholangiopancreatography procedure using magnetic resonance imaging and an injectable dye to examine problems in the bile ducts, gallbladder, and pancreas. Lymph node biopsy is the removal of a lymph node tissue for a pathologic evaluation. Some procedures related to the blood and immune system are a bone marrow aspiration. That's where we remove a small amount of fluid and cells from inside the bone with a needle and a syringe. A bone marrow biopsy is a removal and evaluation of a small amount of bone along with fluid and cells from inside the bone. And an LP or a lumbar puncture, that's the process of inserting a needle into the subarachnoid space of the lumbar spine, and it obtains cerebrospinal fluid for analysis, and it's used to determine if leukemic cells are present. Diagnostic procedures related to the respiratory system, a thoracoscopy or a pleuroscopy, and that's the endoscopic examination of the thorax made through a small opening in the chest wall. procedures particular to the male reproductive system are a prostate biopsy, and that's where tissue samples are removed from the body for examination under a microscope to determine whether cancers or abnormal cells are present. A TRUS, or a transrectal ultrasound, is imaging of the prostate done through the rectum, and it's used to diagnose prostate cancer. Diagnostic tests of the female reproductive system are the cervical conization or a cone biopsy, and that's a biopsy of the cervix in which a cone-shaped sample of tissue is removed from the cervix. Colposcopy is a visual examination of the tissues of the cervix and the vagina using a colposcope to identify abnormal cell growth, and if necessary, it can remove a tissue sample for biopsy. Endometrial biopsy, that's the same thing. That's a removal of a sample of the endometrium to check for uterine cancer, and a mammography is an x-ray examination of the breast used to detect breast tumors. And here we can see a mammography on the left with the pectoral muscle, blood vessel skin, fibroglandular tissues, or fibrous breast, subcutaneous fat in the ducts, and in B, we can see the lower axillary lymph nodes are present there, and the vein. Some general surgical interventions. Brachytherapy, or seed implantation, is a procedure where radioactive seeds are placed inside a cancerous tissue and positioned to kill nearby cancer cells. Cryosurgery is the use of freezing temperatures to destroy tissue. Debulking surgery is the excision of a major part of the tumor that can't be completely removed. Palliative surgery, surgery that's performed to relieve pain or other symptoms but won't cure the cancer or prolong a patient's life. An RFA, or a radiofrequency ablation, is the procedure in which the surgical oncologist uses a small probe and it delivers heat from radiofrequency energy and it kills cancerous tissue. And it's typically used for liver, prostate, renal, bone, and breast cancers. Reconstructive surgery, so that's the surgery performed to return function appearance to a specific area of the body after removal of a tumor. Surgical intervention related to the integumentary system, or is the Mohs surgery, and that's a surgical procedure that involves removing and examining a piece of tumor in the skin bit by bit until the entire lesion is removed. Surgeries or surgical interventions for cancer in the digestive system. A colectomy is an excision of all or part of the colon. An esophagectomy is where a part of the esophagus or the diseased portion of the esophagus is removed. A gastrectomy, or a Bell-Roth operation 1 and 2, are surgical resections or excisions of the stomach. A pancreatic duodenectomy, or a Whipple procedure, that's something that I've seen quite a bit of, is the partial excision of the stomach, complete excision of the gallbladder, a portion of the bile duct, a head of the pancreas, portions of the small intestine, and regional lymph nodes to stop the spread of cancer in these areas. Cystectomy, these are surgical interventions in the urinary system. A cystectomy is a surgical removal of part of all of the bladder. Fulguration is a destruction of tissue by means of a high-frequency electric current, and it's commonly used for tumors inside the bladder. A nephrectomy, incision of the kidney. A TURB, a transurethral resection of the bladder or tumor, and it's excision of the tumor from the bladder through the urethra using a resectoscope. In the lymph system, excision of a lymph node is a lymphodectomy. In the blood and immune system, a BMT is a bone marrow transplant, and that's the transfer of bone marrow from one person to another. peripheral stem cell transplant is the collection and freezing of stem cells from the blood, and then they're reintroduced into the patient after chemotherapy. Surgical interventions in the respiratory system, a lobectomy is excision of the lobe of the lung. Pneumonectomy is an excision of the lung, and a wedge resection is an excision of part of a lobe of the lung. And here you can see a wedge resection of the lung where the lung tissue was removed where the cancer was contained. Additional ones related to the male reproductive system, I think this slide's out of order, is a TURP, and that's a prostatectomy or a transurethral resection of the prostate. These we see commonly, and that's a removal of prostate tissue through the urethra using a resectoscope. Additional ones related to female reproductive system is the LEAP. That's an excision procedure that uses a thin low voltage electrified wire loop to cut out cancerous tissue in the cervix. A mastectomy is an excision of the breast to remove a malignant tumor. And a modified radical mastectomy is an excision of a breast along with some of the underlying muscle and lymph nodes adjacent to the armpit. A radical mastectomy is the excision of the breast as well as the underlying muscles and lymph nodes in the adjacent armpit. And a simple mastectomy is an excision of the breast, leaving the underlying muscles and lymph nodes intact. And a myomectomy is an excision of the myomas. So here we can see the three different types of mastectomies: the simple, the modified, and the radical, where it's superficially the breast and then the lymph nodes and then the lymph nodes and the pectoral muscles involved in that. Surgical interventions of the nervous system are a craniectomy or an excision or part of the cranium to access the brain, stereotactic radiosurgery, which is a radiation therapy technique for treating brain tumors, and it aims high-dose radiation beams directly at the tumor. Stereotactic radiosurgery is the radiation therapy technique for treating brain tumors. It aims high-dose radiation beams directly at the tumor. It's very specific, so not to do damage to the brain. Surgical interventions of the sensory system is enucleation, and that's the removal of the eyeball. Amputations are the surgical removal of an entire limb. Limb salvage surgery is the surgical procedure in which only the cancerous section of bone is removed, but nearby muscles, tendons, and other structures are left intact. Parathyroidectomy, this is the endocrine system, is an excision of the parathyroid gland. A thyroidectomy, excision of the thyroid gland. A transsphenoidal resection is the excision of a pituitary adenoma by making an excision through the nose to the bottom of the skull where the pituitary gland is located. Therapeutic procedures in the endocrine system, external beam radiation and radiation therapy, both used here. So external beam radiation is where that high energy radiation is applied externally, directly to the tumor to minimize damage to other tissues. And radiation therapy is more broad, and it's the use of high energy X-rays or other particles to kill cancer cells. Medications and drug therapies are aromatase inhibitors, and these are drugs designed to reduce estrogen levels in women's body, to stop the growth of cancer cells that depend on estrogen to live and grow. Chemoprevention, the use of natural or synthetic products to keep cancer at bay or to stop the disease process before it becomes invasive. Chemotherapy is a regimen of therapy that uses chemicals to treat cancer. There's adjuvant chemotherapy and interstitial chemotherapy. So adjuvant is given in addition to surgery to destroy remaining residual tumor or reduce the risk of recurrence, and interstitial is placement of the chemotherapy drugs directly into the tumor. We'll stop here.